We have presented before and published that we could increase the pathological complete response rate in patients with triple negative disease when carboplatin was added to conventional anthracycline taxane chemotherapy. Of course, when you add an additional compound, you want to know, are there maybe patients that might have a higher benefit, and with that the risk-benefit ratio, additional toxicity is getting better by this. And so we have presented at the last ASCO meeting already an analysis where we looked for germline BRCA mutations in these patients, and we could see that there is a higher pCR rate in those patients with a germline mutation, but the number of these patients is small. It's 19%, and so we're looking for other possibilities to maybe enlarge the group where carboplatin has a specific efficacy, and that is why we ended up in running a project together with Myriad to look in how far their new test that is a homologous recombination deficiency test can identify a larger group where carboplatin is active. When you have a diagnosis of breast cancer and you decide, well, this is a patient that needs chemotherapy, then usually in triple negative disease, in many guidelines, it's now recommended to do this as a neoadjuvant treatment before surgery. And then you have to plan in how far, which components this chemotherapy should have. And so far we know triple negative disease is more a basket of a large variation of different breast cancers, where we only have first hints how we can maybe subdivide them. But these genetics subtypes that are currently being discussed, there's not a good link to treatments so far. So in the past, new subclassifications in breast cancer were only accepted when there was a link to a specific treatment. So hormone receptor positive treatment to tamoxifen, and HER2 positive treatment to the anti-HER2 agents. And as we saw this effect of carboplatin, we wanted to see in how far we can carboplatin is a DNA damaging agent, and in how far there is a group of triple negative tumors that is specifically sensitive to this DNA damage. And of course, the first group that comes into mind is those patients where the DNA repair is impaired because of a BRCA mutation. But we know that this is only one group, and there are other reasons why the DNA repair in triple negative breast cancer might be deficient, and that is the intention of this test, to identify this group. Yeah. So we have the HRD test actually looks for two things. First, it looks for tumor BRCA mutations, so not for germline mutations, but BRCA mutations in the tumor, and it assesses different ways of DNA structures, and a score is calculated. So a patient with is considered to have a HR deficient tumor if either the tumor has a BRCA mutation or the score is high. So and this both together we call HR deficient. What we first found out is that we, as I already mentioned, we have this 20% of germline BRCA mutation carriers. Then when we look in the tumor, 30% of the tumors show the BRCA mutation, so it's more frequent by additional somatic mutations. And the HR deficiency was found in 70% of these patients. So in additional 40, the HRD score was high, but no mutation was found. And the pCR rate in all these groups was higher compared to those tumors where no DNA repair deficiency was observed. And then we were looking in how far the effect of carboplatin is interacting with this, and the data are not 100% consistent, but if we look for one of the pCR definitions, there we can nicely show that patients with no HR deficiency, they do not benefit from carboplatin, whereas those with either a higher HR score or those with a tumor BRCA mutations, they had a more than 3 times higher pCR rate compared when they got carboplatin compared to those patients that did not get carboplatin. Carboplatin is not working in all triple negative patients. We will probably be able to subdivide this group either by BRCA testing or maybe in the future with this new test. These are retrospective studies, so they have to be confirmed. And there's a project running currently with another trial. And if this trial turns out to provide the same results, then this test could be used to make the decision in how far a neoadjuvant treatment should be given with carboplatin or without.